affordability and accessibility of medical care. And my first thought is to the primary healthcare centers where it's within the local government purview, right? And it's really saddening to see that it's often in very dilapidated state, and we don't see as much medical workers.
In fact, Joy, is almost a joke. That's the truth.
I don't want to be that there exactly. And yet these are the people who should be closest to the rural communities. And sometimes we see just one in miles. We don't see another one. So if you have to suggest the way we can revamp that sector, what would be your reaction?
Key thing, let me draw this out. I keep going back to this 133 million multidimensionally poor people, and like you rightly said, these people are more in the rural areas. Okay, now you have about 9,000, probably maybe a little bit less, wards in the 774 local governments around the country. Okay, now one of the basic things that must happen, that should happen with primary healthcare, is that each one of those wards must at least have a primary healthcare center. Okay, now the primary health care system or whatever is domiciled with the local governments in Nigeria, and the local governments within the Nigerian space are almost non-existent when it comes to that capacity, be it in terms of funding, financing, in terms of the organizational power and stuff like that. You understand? Non-existent. And guess what? The primary healthcare system is the bedrock. Okay, is the foundation of any healthcare system. Okay, so that means that when I started initially, I told you one thing, that we have a very weak healthcare system, and we need system strengthening within the healthcare space, isn't it? So one of the key things that we must focus on, especially within the next 4 years, must be the primary healthcare system, because just delivering that sort of basic healthcare to those 133 million multidimensional people, vulnerable people. Any government that does that, if the next government that comes, they can do that and actually provide that, they have done a yeoman's job. Okay, so what do they need to do? Again, going back to some of the things I talked about, we need to actually make sure that we actually get data. Okay, the National Population Commission is going to be carrying out a census soon. Okay, so we need all that data, and we, of course, we need to harmonize as well. Remember, we have that national identity management thing. We have all the BVNs and stuff like that. Even our PVCs and stuff like that. All this information needs to be harmonized. We need to know the different social classes of people, where they are and stuff like that, so we can actually plan, at least for the primary healthcare space. Okay, that's really, really important. Second thing is funding. Like I said, the local governments are too weak. Okay, now the federal government with its muscle must MUST get involved in primary healthcare. Okay, they must. There's no going around it. They must, and they must, and they must. Okay, so when it comes to funding and service, funding for that level of service delivery, they must get involved. Okay,